you. Position ourselves, those who come to us that we market. So I invite you to relax for the questions that we have for today as we be going through some of the questions we have received. But next week, we'll be going on with our sessions about a healthy metabolism. I'm saying this because some of the questions that have come through are to do with insulin resistance. So I shall not speak about that today, but just to say that next week we'll be continuing with our healthy metabolism, because as I'm sure many of us are aware, a lot of our illnesses, serious lifestyle-related illnesses, originate from our metabolism. And that is why it's good for us to be well informed so that we are able to also look at our lifestyle choices and see how we can use a supplement in conjunction with healthy lifestyle choices to maintain good health and to educate others about it. So without further ado, I want to go to our first question. This was a question about systemic blood clots. So I think we are aware that blood in starting the process of wound healing. So if you maybe get scratched or cut, the body uses in stopping the bleeding is by forming clots on the surface of the wound, in the wound, and then supposed to be floating about in blood circulation, should be completely fluid. And so when blood clots appear in blood vessels or in tissues, it is an anomaly and a cause for great concern. Sometimes the systemic blood clots can be familial, that it tends to run in families. Sometimes it's in reaction to certain medication. Artificial contraceptives some people can actually experience blood clot. And nicotine, as well as cigarette smoking, can also be a source or an increase. And that is why, for example, when you're going on a recommend that you keep legs so that you avoid the possibility of forming blood clots. So if you are in the high-risk area, let's say your family has a history of this, or you are a person who is using medication whose side effect is one of this, I think it is important to be a bit cautious so that you increase the amount of exercise and movement in your lifestyle. This is, of course, something we recommend for everyone. And also to opt for a healthy heart diet. That is a diet that sorry, we just need to do a sound check because it seems to be unstable. All right, so the supplements that we recommend from Neolife will be lipotropic adjunct. We recommend omega-3 salmon oil, garlic allium complex, as well as magnesium complex. So those four should be useful in assisting with systemic blood clot, and this is in conjunction with a healthy heart, life, and diet. Then the next question was about the pancreas. In one case, it was inflamed, and in another, it was getting filled with fluid. So if you recall, one of the training had, we mentioned the little organ called the pancreas, which is produces insulin and other hormones, which are involved in blood sugar regulation, as well as in producing digestive enzymes. So a problem to do with pancreas, we directly look at our sugar metabolism and the health of our metabolism, because when the organ starts being filled with fluid, it indicates inflammation. It indicates that the organ is not performing as it should, or it is stressed with having to overproduce some of its hormones or enzymes. So as I mentioned, the pancreas is concerned with the production of insulin and glucagon. And these are both hormones that are involved with our metabolic health. So the first supplement we'll recommend here will be Botanical Balance, which assists in our sugar metabolism and the regulation of sugar in circulation in our bodies. We will also recommend omega salmon oil, and we also recommend that you make good diet choices. This is always make sure that the commonly processed and rich. This is because important contribution to our metabolism. It helps to reduce the speed at which sugar enters our circulation, and it also binds to certain toxins and carries them. Make sure that your carbohydrates are rich in fiber. You can also add our fiber supplement, fiber tablets, if you find that maybe your diet, for one reason or another, is not providing the amount of fiber that you require. So make sure also for that, for this reason of the functioning, good functioning of your pancreas, that you terminate habits such as excessive use of alcohol and eliminate and junk food from your diet. Then there's a condition that comes frequently, and this is sickle cell disease. And here, what we will mention a few things about it. Sickle cell disease is a genetic illness. It occurs when each parent is a carrier and donates one sickle gene to their child. Such a child with two sickle genes is going to have sickle cell disease. If they only have one, then they only have what we call sickle cell trait, and they will not have a lot of the issues that people with sickle cell disease experience. So some of the things that you need to be cautious about with sickle cell disease, number one, hydration is very, very important. So right from early in childhood, the child should get in the habit of drinking plenty of water and other fluids to make sure that they do not become dehydrated. We also recommend to avoid large temperature fluctuations, because a sudden change in, especially a sudden drop in temperature, can cause a sickling crisis. And also schedule and prioritize sleep and rest, because one of the side effects of sickle cell disease is that it causes tiredness and fatigue. So in order for the child or the adult to keep up with their activities, they need to make sure that they schedule sleep and rest so that they are able to keep up with things. Then we have supplements that will help with improving the quality of life of someone with sickle cell by ensuring that their bodies have the raw materials they need for repairing the damage caused by the disease, and also for ensuring that their blood and their energy production is working all right. So we cannot cure sickle cell disease. The only cure that I know of for sickle cell disease is getting a stem cell transplant, and this requires that you get a suitable donor. Who, if you get a suitable donor, you can get a stem cell transplant, which can actually cure the illness. So the supplements we recommend will be chelated zinc. Zinc is very important for helping to heal internal wounds. Because of the way sickle cell operates in the body, there are usually a lot of injuries inside the body because of the breakage of the blood vessels. And also some of the joints can be damaged, the eyes, and there can even be strokes. So chelated zinc, very important. They should be taking it on an ongoing basis. The other one is vitamin B complex, very important for energy production and the making of blood and many other activities in the body. So vitamin B complex also very important. And then we recommend Pro Vitality, so that the adults on preteens, teenagers, and adults. So vitamin B complex. So Pro Vitality is quite good, Iron people with sickle cell, because although they are breaking down their blood, the iron from their blood, they are also supplementing with iron. It can cause some issues for them. So for that reason, I remember also Vitality has got omega-3 salmon oil, very important for blood health and for helping that accompanies sickling crisis. It also has carotenoid healing process, and complex is an antioxidant which will help with 3 minis, as well as periodic use of Neolife Shake, especially because sometimes children with sickle cell can have poor appetite. So if they are struggling with their appetite, Neolife Shake can help with supplementing their protein intake. For infants, of course, the supplement we have for infants is Liquivite, but for all babies and all infants, we recommend breastfeeding for 18 months to 2 years. This is a very healthy thing in general, but for these children with special needs is even more important. The next question was about an inflamed leg. So inflammation in the leg can have various causes. Some are rooted in type 2 diabetes. Others are due to cellulitis and inflammation of the tissues. And so I will recommend that it's important to try and see a doctor. You may need antibiotics if it's an infection. So just do a bit of investigation to find out the root of the inflammation on the leg. Exercises to strengthen the calf muscles will be important. So flexing ankles, wiggling toes, and walking, all these help to strengthen. The calf muscle, as you know, is the big muscle in the lower part of the leg. And this muscle plays an important role in circulation. It helps when it's strong and healthy, it helps to pump the blood back up towards the heart. So that is why if you've got issues to do with the swelling of legs, fluid collecting in the legs, we always recommend exercises that strengthen the leg muscles. When you are sitting down, try to have the legs elevated above the level of the heart so that you help to drain the fluid from the lower parts of the legs back up towards the torso. Then we recommend for inflamed leg to use flavonoid complex. If flavonoids are not available, we may use vitamin C, but flavonoids are a good choice. Then also multimineral alfalfa. We also recommend omega-3 salmon oil, and you can add chelated zinc. Someone wanted to know what to recommend for a person who is undergoing chemo and having bouts of diarrhea. So because the chemo is ongoing and it is the one causing the diarrhea, it might not be possible to completely stop it. So unfortunately, while they are undergoing chemo, this might be an ongoing problem. But we suggest that you use aloe vera plus as well as fiber tablets to restore the gut microbiome. And also you can add fermented foods from your culture. And once chemotherapy has been completed, you can then go on to use Beta-Gut to help detox your body from the chemo drugs. But we do not recommend that you use Beta-Gut during chemotherapy. Wait until the chemo sessions are finished, then you can detox with Beta-Gut. And as I've said, because the cause of stomach upsets and diarrhea are actually something that you have to keep on taking, you may find that we are not very efficacious in getting rid of the problem. Nonetheless, try to use aloe vera plus, which is a good tonic for the system, your digestive system, and fiber tablets will be a useful addition to help you to restore your gut microbes. Another question was how to strengthen weak teeth. So remember that whenever we are talking about the health of our teeth, it must include the health of our gums, because the teeth not only grow out of the gums, but they get their blood supply and their stability in the gum. So when you think about weak teeth, think about how the health of the gums as well. So the first thing is to maintain good oral hygiene. But brushing teeth, especially before going to bed after the last meal, so that there are no food particles remaining in the mouth when you're sleeping. This is because when we are sleeping, the circulation of saliva is a lot less, and the microbes the disease causing microbes in the mouth will be having a very nice time eating the leftover bits of food that are still in your mouth or between your teeth and so on. So at the end of the day, before retiring, make sure that you brush your teeth and go to sleep with a mouth that does not have food debris. Gargle water in your teeth, and also maybe take care that your tongue is also brushed or scraped with a spoon. And then eliminate sugar and refined carbohydrates from your diet. Another important thing is to include hard things in your diet. Unfortunately, these days, our diet comprises only of soft things. And remember the saying that what we don't use, we lose. Our teeth are one of the strongest compounds in our body. In fact, long after, I'm sure maybe if you've grown up in the countryside like myself, you may have seen that. And the skeleton of a dead animal may have very little left, but the teeth are always intact. This is because the teeth are very strong and should have a lifetime guarantee. So if you notice that you're having problems with your teeth, one of the things is to include hard things in your diet so that your teeth get used to dealing with hard things, such as the kind of food we call githeri or nyoyo, which is a mix of maize and beans. So the maize tend to be hard. Also, chewing on bones and nuts and so on. So avoid just having everything mushy and cooked to extreme softness, because then it does not challenge your teeth to perform strongly. Then on the supplement side, we are going to recommend CalMag, which calcium is one of the important components of our teeth, the compounds of which our teeth are made. We'll also recommend vitamin A plus D. Vitamin D helps in the absorption of calcium. If you get good, adequate sun exposure, then your skin is able, when your skin is exposed to the sun, then your body is actually able to make vitamin D, which will help with the calcium absorption from your CalMag and your diet. Then we also recommend vitamin C, sustained release, for gum health. If you notice, for example, that your gums tend to bleed, it may be that you actually need to step up your vitamin C supplementation. So those are what we recommend for weak teeth. And then another question was about cataracts. So cataracts are the filmy stuff that we get on our eyes, sometimes as we grow older and sometimes not so old. And unfortunately, cataracts is also linked to sugar and poor sugar metabolism. So eliminate sugar and refined carbohydrates from your diet if you have a familial history of getting cataracts. If you have type 2 diabetes, then resolve the type 2 diabetes, because not only is it one of the leading causes of blindness, but of other eye diseases, eye conditions. So the supplements we recommend for cataracts will be carotenoid complex. Here we would say take a double or triple dose if you already have cataracts, to help the body to resolve the cataracts. Then we also recommend omega-3 salmon oil, as well as vitamin B complex. Remember that lipotropic adjunct can be used in exchange with B complex. If you do not have B complex in your market, you can use lipotropic adjunct, which is quite rich in the vitamin B family. So carotenoid complex, omega-3 salmon oil, and vitamin B for cataracts. I would say that as we grow older, this should be an ongoing thing. So if you are a person who is doing our basic supplementation with ProVitality, you already be having carotenoid complex and omega-3 salmon oil in your Provitality. So you can then just add vitamin B complex to take care of your eyes so that this issue is avoided. But if you've already started having cataracts, don't wait until they're severe. Maybe get into action immediately by taking a double dose of carotenoid complex. Then we go on to the next question, was about ovarian cysts. So I think we have had quite a number of questions of different types of cysts. So cysts are fluid-filled growths that grow on different organs. Some of them are found on the kidneys, some on the ovaries, even on the uterus, and various other body parts. And these are the group of things that we call unwanted growths. And so generally take care of your lifestyle choices, follow a healthy lifestyle, and then add cruciferous plus, which helps in the body resolving unwanted growths such as these cysts. We also recommend chelated zinc, vitamin D, and if you have blood sugar issues like pre-diabetes or insulin resistance, we recommend that you start on botanical balance. This includes things like polycystic ovarian syndrome, another one of the cyst growing conditions. Add botanical balance and opt for a diet that is healthy. Try to eliminate carbohydrates that have no fiber in them. Remember that carbohydrates are a good food, but they usually come packaged with fiber so that they do not cause problems for us. So whenever you are choosing your carbohydrates, the majority of your carbohydrates should be fiber rich. So I'm thinking about things such as whole grains, if you're taking whole grains. And this, as I think I've said before, make sure that you actually know that the substance is whole grains, because some of the labeling might not be quite as accurate as one might want. So rather get the grain and mill it yourself. We have that possibility still here in Africa. I know in many countries this is not possible, but here in Africa you can still buy your grain, go and mill it, and that way you know that it is whole grain. We have got many types of dishes that have grains that are eaten whole. We also have got other starches that are rich in fiber, such as cassava, yams, and so on. And then, of course, you can add plenty of vegetables, legumes, and so on as sources of carbohydrates that are rich in fiber. Next was, I had a number of questions about cancer. So one was about lung cancer. So we'll recommend Phytodefense and omega-3 salmon oil for that. Then we had a question about chronic kidney disease. This one is another frequent one. This one was with someone on dialysis. Remember that when someone is already on dialysis with kidney disease, it means that the kidneys are really struggling, which means we want to not give them too many of things that will overload the functioning of the kidney. So minimize your toxin load, which means eat foods that do not have additives, and look at your environment and anything that could be increasing your toxin load. Then get plenty of sun exposure and stay well hydrated to support your kidneys in their functions. Then the supplement we recommend will be vitamin B complex, which tends to be deficient in people with kidney disease. We also recommend Beta-GAD to help with the detox for function of the kidney. And we recommend vitamin A plus D. And sometimes the kidney problems go hand in hand with heart problems. So if you also have heart issues, to those 3 supplements, we also recommend you add coenzyme Q10. If the kidney disease is going hand in hand with type 2 diabetes, or if the family of the sufferer has got someone with type 2 diabetes, then definitely add botanical balance. So I think I've mentioned on previous occasions that one of the causes, the leading causes of kidney disease is type 2 diabetes. And that is why, unfortunately, we are seeing a lot of kidney issues coming about. Hospitals are being opened which specialize just in dialysis, which means that there are people investing in the fact that your kidneys are not going to serve you for the rest of your life. support it by making good lifestyle choices. Then I had a question about for someone who is undergoing chemo again and has had a mastectomy. So again, as with the other cases of cancer, our first recommendation is phytodefense, and we'll also recommend Neolife Shake and other healthy lifestyle choices. Then there were several questions about varicose veins and problems originating from problems to do with weak veins. So a varicose vein is a swollen vein that protrudes just near the surface of the skin on the legs, especially the calf muscles and the lower parts of the thigh. And this problem can go on, and these small swollen veins can appear in various parts. Usually it will be on the lower part of the body, the legs and the thighs and so on. So unfortunately, we cannot reverse varicose veins with supplements once they have occurred, and especially when they are quite big. The only thing that can be done is either use a laser treatment, so see a doctor about that, or surgery. So some of the ways in which you can help, and this again is to prevent the problem from getting worse, because it does get worse. And if you have family members who have got varicose veins, then probably you should already be taking precautions. And so one useful thing is to use compression stockings or bandages. So you can get this from a pharmacist or even from a supermarket in some cases. This helps to support your leg muscles so that they are able to pump the blood back towards the heart. And as I said at the beginning when I was speaking about, I forget what it was, but about the calf muscles being, or inflamed legs, yes, is what I was talking about. So compression stockings are useful for this, as well as exercises to strengthen the calves and the legs, and then elevating the legs, as I said previously. And then the supplements we recommend for varicose veins would be flavonoid complex to help strengthen the veins. Remember, flavonoid complex has got small amounts of vitamin C. And then we have chelated zinc also, and vitamin A plus D or vegan D, depending on your preference and availability. Then the next question was about venous ulcers. So venous ulcers are what happens when varicose veins get worse. Then you will start having parts where the skin breaks and you form wounds or ulcers, which may struggle to heal. But if you take some of these precautions that we are recommending, you can arrest the problem before it becomes very bad. Unfortunately, if you let it go very far, then the problem would be difficult to resolve. So again, here with the venous ulcers, compression stockings will help a lot, or compression bandages. You can discuss with your medical provider or with your pharmacist if they are selling compression stockings or bandages, which one would be more suitable for you. This will support the circulation in your legs and prevent the pooling of fluid in the legs. Because what happens is that if the circulation in your leg and feet become very poor, then the blood and fluids will be collecting in your legs and ankles. And with time, they are going to cause the blood vessels to crack up, and it's going to form wounds. So elevate your legs when you're sitting or lying down. Regularly do exercises to strengthen your legs and calf muscles, and apply skin lotion to keep your skin from getting very dry, because then it forms ulcers even more quickly. So the parts of the skin that are not ulcerated should be kept well moisturized using lotion. You can add a bit of Vaseline to your lotion if your skin is very dry. So here I still will recommend flavonoid complex, chelated zinc to help with the healing of the ulcers, and omega-3 salmon oil. So those are venous ulcers. I think that I will leave you with this question. And someone wanted to know about, which I thought was interesting, if it is safe if you have been using omega-3, 6, and 9. So there are some preparations that have got all the 3 omega oils. And if you move to omega-3 salmon oil, I would recommend moving to Neolife omega-3 salmon oil, because omega-6 and omega-9 are plentiful in our diet. You can get them from cooking oil, from eating avocados and nuts, and so on. But omega-3 is quite tricky, because we tend not to get sufficient amounts. For us to get sufficient amounts, we need to be eating a minimum of 200 grams of fatty fish a week. So this includes fish like mackerel and sardines, which are very small. They are small fishes, so for you to get 200 grams a week, you need to eat quite a number of them and to have them available. And the other good source of omega-3 is, of course, salmon fish, which tends to be on the expensive side and might not be available for many of us. So for that reason, supplementing with our omega-3 salmon oil is a very good idea, because then you will be able to get the other ones from your diet, from your avos and your nuts and so on. There are also some plant sources of omega-3 that I see being talked about. Unfortunately, their bioavailability is not so good, because the way in which omega-3 occurs in plants, let's say something like flaxseed or walnuts and so on, it has to then, when you take them in plant form, it first has to be converted into a form that we readily use, and the conversion rate is only 15%. So you would need to eat a very large amount of flax seeds and walnuts for you to be able to get the required amount for your health. So rather than all that, focus on eating a healthy diet with healthy fats, and then adding to that omega-3 salmon oil, which will give you the tricky omega-3, which is the one that we tend to not get, unless we are a fish-eating community that gets plenty of mackerels, sardines, and salmons. So I want to thank you very much, and to apologize for the issues that we have had. I hope that you are able to hear the majority of what I was talking about. And then I would like to also wish you all the best in all that we do. Remember, as long as we are doing our Neolife business, we are making the world a healthier and happier place. And continue to send the questions. We try to keep up with them. At the same time, I would like to invite you to keep on making your goals and going for those goals. Here is Pascal now. He's going to speak with you about our business side of today's session. Thank you very much.